Let's turn now to virologist and NBC News medical contributor Dr. Joseph Fair. Dr. Fair, good morning. I'm sure you were watching Dr. Fauci's testimony yesterday saying that if things don't turn around, we could have 100,000 cases by very, very soon. At the same time, you have the CDC deputy director saying the other day, we're past that point. We're past the point of being able to control this. How do you see it?
Well, I don't think the two statements are mutually exclusive from one another. You know, what Dr. Fauci said, if we're following the trajectory that we are currently on and have been observing the past few weeks, we could very easily get to that number or maybe even surpass that number. And as far as what the CDC said in their own statement about not being able to control the virus, this goes back to something you and I spoke about earlier about this virus potentially and increasingly looking like it's becoming endemic to the United States, meaning that it's going to be here until we get a vaccine. All of the traditional measures that we would use to normally control a virus or eradicate it have not worked in the United States in particular for a variety of reasons. Thus, we have the numbers now to kind of make it, I won't say impossible to eradicate it using traditional means, but extremely difficult to do so. So,
I mean, that sounds rather hopeless. What does that mean? You just give up, or you just keep trying to do social distancing and the mask? I mean, I don't know where to even go with that. Is it giving up?
Yeah. No, absolutely not giving up. And, I am not ready to throw in the towel. And there are still things that we can do to get through this until we either have better therapeutics or a better vaccine. And, I'll go back to something that we have talked about really since February or March, which is testing. There needs to be a breakthrough in testing to make it very easy, something preferably saliva-based where you don't have to poke someone several times per day. Testing will allow us to know where we need to focus our energies the most. It will allow us to do that isolation and contact tracing that Dr. Fauci said we need to do so aggressively. We need to recruit a contact tracing corps and, think about census takers. It would be the same kind of thing. You don't need to be a doctor to do contact tracing. So if we did all of those things starting now, and I emphasize the earlier we start, the quicker this will be over. If we did all of those things now, we still have an opportunity to control the virus and reduce it greatly.
And what about masks? Because we saw yesterday a lot of top Republicans, Mitch McConnell, Kevin McCarthy, Lamar Alexander, coming out and basically saying, come on, everybody, just wear a mask. Will it make a difference? Could it really stem the tide?
I think what confuses people the most about the mask has been the conflicting guidance. And I myself even gave some of that guidance in the beginning because I was following what we knew from SARS. And that's what the original guidance was based on. Overwhelmingly, since this outbreak has started, we have seen that masks both aid in the prevention of the disease and to a much more limited extent catching the disease yourself. So masks seem to be the key public health intervention that we can use in addition to social distancing, of course, but masks seem to be the key intervention that we can use to prevent the spread of the virus further.
All right, Dr. Fair, good to get your perspective as always. Thank you so much.